Hi, I'm Fred Rivara. I'm the chair of the planning group, and on behalf of the Board of Children, Youth, and Families and the Committee on Law and Justice, I wanted to welcome you here this morning for this two-day workshop on bullying prevention. In addition to the people in the room, we are webcasting this meeting, and I'm told there are more than 200 people who are participating remotely, and they will be participating. They will be sending in questions for us to address as well. So why are we holding this workshop? The answer to me lies in the kinds of news stories that I randomly selected from a multitude of stories on the web. Let me just go read a couple of those to you. In October, Brad Lewis, an Illinois dad, got the kind of call that no parent ever wants to receive. His ex-wife was on the phone. The 15-year-old son had shot himself in the chest. The note Jordan left behind, he laid blame on being bullied at school. In September, 12-year-old Rebecca Sedgwick jumped from a silo at an abandoned cement plant in Lakeland, Florida. Police say she endured repeated taunts by peers in school and on social media. Two girls, 13 and 14, have been charged with felony aggravated stalking based on evidence of a year of online taunts and threats. When Tyler Long, a 17-year-old high school student from Murray County, Georgia, found himself being verbally abused by his classmates, he did what we tell teenagers to do: tried to ignore them and went to his teachers. When Tyler's complaints fell on deaf ears, he made a tragic decision. He wrote a suicide note and hanged himself in his bedroom. Mike Maroney's, an 11-year-old North Carolina boy, was found hanging from his bunk bed late in February after he finally cracked under the pressure of his preteen tormentors at school, after being repeatedly bullied over his love of My Little Pony. Yes, bullying has existed forever. It exists in old forms of taunts and social shunning, but it's also morphed into new forms, parallel to the rise of social media and technology in the lives of our kids. Over the last 30 years, I've worked in the area of controlling and preventing injuries. One of the things that I've learned, this necessary approach, is to believe and act with the premise that all injuries are preventable. The deaths from the mudslide in my own home state of Washington last month really must be viewed as preventable and not as an act of God. The commuter train that injured a dozen people and killed 4 in New York City in December was easily preventable by available technology. So too, I believe that victimization by bullying must be viewed as preventable. It should not be ascribed to just, this is what kids do, just between them. It's relatively harmless, and that we as adults don't need to do anything or shouldn't be involved. So the goals I have for us is that we should work the next 2 days to look at how we can prevent bullying and the consequences of bullying to the victim, the perpetrators, to their schools, and to our society. To do that, we put together, I believe, an outstanding program. It's developed by the committee consisting of Catherine Bradshaw, Nina Fredlin, Nancy Guerrera, Denise Gottfredson, Megan Moreno, Jonathan Tadros, and myself, and organized by the wonderful Institute of Medicine staff, Patty Simon, Tara Monero, Stacy Smith, and Kimber Bogard, the Director of the Board of Children, Youth, and Families. The workshop has been funded by the Health Resources and Services Administration. Following me, Dr. Michael Liu will give us the perspective of the sponsor. The goals of the workshop are to inform a roadmap on the next steps to take in preventing bullying. Specifically, is to look at what we know about bullying, the risk factors and consequences. We know that what works and what doesn't work, how these relate to other risk behaviors for kids, and who needs to be involved in bullying prevention. Today, we'll first have an overview of bullying and victimization, followed by a review of the research on risk factors, protective factors, and resilience for bullying. This afternoon, we'll address intervention strategies, those based at schools, those involving families, and those using technology. We have tried to build ample time into the discussion in the agenda. And I ask that all speakers please keep to their allotted time so we can have enough time to engage the brain power in this room. We also have 2 unique panels to help us keep this real and pertinent rather than esoteric discussion of research. We have a youth panel of 5 students who Meg Moreno will introduce to you shortly and discuss how we hope they will be able to help us. Secondly, we have a panel of 3 educators from across the country who will be introduced to us by Catherine Bradshaw. Thank you, and I look forward to the next 2 days. The slides and webinar will be posted online within 2 weeks, and a workshop summary will be published in August or September. So now I'd like to ask Michael Liu to come up. He's the Associate Administrator of Maternal and Child Health at HRSA. Michael.